Many shades of pink and black health. Many shades of pink and black health, where good health equals long life. Welcome to the Many Shades of Pink and Black Health radio program on KBOK. On KBOKradio.com, sponsored by Many Shades of Pink. I am your host, Wendy Sherrill, breast cancer survivor and advocate.
And I'm your co-host, Dr. Susanna Fall, and we have the pleasure of having a guest today, Mr. Terry Robinson. He's an insurance agent, and today the topic is Hornets and Friends, second annual cancer and diabetes event. So, Terry, welcome to the show today.
Thank you.
And we're going to spend our hour for two things. Number one, getting to know you and who you are, but also promoting the event that's coming up on Saturday.
Okay.
Yes. Yeah. So why don't you do us a favor, just tell us a little bit about who you are, and your family or where you're raised, that sort of thing.
Couldn't do that. Once again, guys, I'm Terry Robinson. Actually, I'm born and raised in Portland, Oregon. Just joking.
Oh, because I was going to say.
That was just for the people out there that know me.
Okay.
Born and raised 45th and Logan. Lived in a number of places, but a lot of my time was spent 45th and Logan, where I lived with my dad and brothers, sisters, etc. And just growing up in the neighborhood, lived there before 45th Street Park was actually even built. We used to have dirt rock fights back there on that lot before it was ever an actual park. Grew up going to Kennedy. I went from Kennedy Elementary to Gompers to Lincoln. So that little triad. Spent 3 years walking back and forth up and down 47th, going to school with friends. And my family, I actually live in Portland, Oregon now. I have two granddaughters, my son and his wife. And then I have a daughter who's a basketball coach no, she's not a coach anymore. She's a strength and conditioning coach at St. Martin's College up in Lacey, Washington. And then I have my son, Max, who's about a year out of high school, trying to figure out life, what he wants to be when he grows up. And then I actually am blessed to have a 3-year-old named Jonah, and he's kind of the mascot of the family.
So I think I lost count. Do you have 3 boys and a girl?
Yes.
Okay. All right. Okay.
Yes.
You were throwing them all over the place.
I know, huh? I should have started with bottom, but I went down.
Okay.
Actually, my kids they just left Disneyland last night, and they were at Disneyland for about a week. So, not my kids, but my son and his wife and another family, some folks that I work with. So, and I keep hitting the table, and I just gotta so let me sit up straight here and like my mama taught me. So, I just recently, speaking of what I do now, I spent 25 years in telecommunications. I work for all the major carriers. I've built Wi-Fi networks, and I've been a cell phone retail manager, and you name it, I've done it in the telecom industry. And just came to a point where I wanted to be my own boss eventually. And
well, that just brings me to the next question. Why and when did you become an insurance agent, and what motivated you to become an insurance agent?
I want to give credit to a very close family friend named Robert Williams, who is my son's best friend. He is the advisor for the district office, and on a couple of different occasions, back in 2015, I was studying to be an insurance agent because it seemed like a good life path for owning a business at some point. We don't have enough people of color in the Portland metro area that sell insurance, and that was kind of another reason. And my mother passed away, and one thing, if you've ever gotten your insurance license, you have to be laser focused. You have to stay in it to win it until you test and pass. And then, I took about a month off, and I kind of lost interest in it. And I think there's a degree of God was in this time, because I ran into a friend at a career fair. I was kind of tired of working for Verizon, and he told me about farmers. He was like, oh, they pay for your training and licensing. And then the next day I got a call from farmers.
Wow.
Okay, Robert didn't know I was coming, who I mentioned earlier. I walked in there, I said, does Robert Williams work here? They said, yeah. And it's been on since then. That was in October.
So for become an insurance agent, you have to be licensed in so many different states. Is it true I know my daughter works for Allstate, and So is it limited, or are you able to get licensed in as many states as you possibly can?
Two things. There's two variables in that. One is who you work for. You can get, like right now I can sell in Oregon, Washington, and California. That's because the agent that I work for has an assignment. He's actually is able to sell in California, so I can sell through him.
Okay.
But generally, in order to you get a non-residence license, it's basically paying a fee, and they allow you to sell in the next state. And then it becomes about what your agency and or your carrier does in each state. So it's a process. You start out as what's called a producer, but you have all your licenses, and then you build into. I'm in what's called a protege program, where I am being trained to own my own agency.
Okay.
So a lot of people just get their producer's license, and they come in and they sell life. They come in and sell property and casualty, car insurance, home, blah blah. I did all 4 in 3 months, and I passed on the first time.
All right.
Oh, well, congratulations.
I have not been to school since the 80s.
Okay.
And 55% of people who take the property and casualty and or the life and health fail the first time.
Wow.
I got, and here's what's crazy. I got 77 on both tests.
Okay.
So I adult achievements, that's way up at the top of my list. I'm very proud of myself for that one.
And that's a short time frame to cover all of that in 3 months' time, to study and really get it under your...
And plan this event.
Yeah.
We'll talk about it in a minute.
We will talk about
it
that.
was bearing myself. I had to change my life. I gave up my life for about 3 months to just study with the phone ringing, with vendors, and we'll get into all this, and conference calls, and it was the biggest challenge of my adult life. I feel like it was at 54. It was pretty challenging.
So if you conquered that, then you can conquer pretty much anything. So that was a true test of if you could multitask, number one, and still stay focused and achieve the goal that you had set out for.
You know what's interesting is you and I have talked quite a bit. You and I have talked about challenges. I don't know what no. No is just means, okay, what's the alternative? No is just an alternative to what's next. And so I've dealt with a lot of no's, even what we're going to talk about, eventually here. And all those about 99% of those no's turn into something different than a no. And I was definitely scared to do what I did.
All right.
So that was like when you actually have been doing something for so long, and then you just have a aha moment. It's like, I need to do something else. And so that's like that's a really big challenge, and something that you had to think long and hard about making that career move.
Not really, because I've been searching personally for something different to do. I've been in management for so long. I've owned some businesses. I've gone on some projects that failed, that I knew I did my part, and then the partnership didn't really come together, didn't gel. And I knew that if it was on me, I could accomplish it and then bring people in. Not, sometimes I've had 3 different situations where I've tried to start at ground level with people, and not everybody has the same intensity or the same career goals, etc. And they've got other jobs, and they've got the girlfriends and wives that really pull them away, which is, family's family.
Yeah.
Or husbands. I don't want to just make that one side. I saw you smile over there. But but for me, I could control my situation up to a certain point. I still have to work for farmers and follow their rules, but at a certain point, I'll be able to control my own destiny, and that's the end game. And the flexibility of being down here with you guys, and doing what we're going to do this weekend. That's part of the bigger goal. If I could stop right now and do this for a living, what we're going to talk about, I wouldn't be worried about insurance. That's
wow. Okay.
But something has to pay the mortgage.
Someone got to pay the mortgage.
Someone's got to pay the bills.
Listen, every time I take my spiritual gift test, it comes out faith, helpfulness, and evangelism or pastoring. And I told my mom, and I was waiting for this answer of her to tell me what to do, and she said, "What you gonna do?" I was like, Mom, that's not the answer I was looking for. I need you to tell me what I'm supposed to be doing right now.
You got to listen from the voice up above.
Exactly. And that's her point. She's like, my hands are tied.
Yeah.
Somebody else is talking to you, it's not me.
Yeah, and you got to pay attention too.
So tell us what type of insurance you sell and you offer.
What time do you need is the question.
Okay, well, we want to know what you offer.
I am licensed to sell property, casualty, life, and health.
Okay.
Now we don't currently, in my agency, we don't do health yet. Health is
Okay.
kind of it's a moving target because of what's happening in our society with healthcare and
Right,
the threat that Medicare may change. But I'm versed in it. If you ask me give me a multiple choice with a question, I'm good. But if you want me to talk to you about selling it, no. But as far as life, property and casualty, there's so many things. The one thing I always tell people now is when you see these commercials with the general or these other, the lowest insurance is not the best insurance. The lowest insurance means I'm covered. But if you got a $10,000 property, limit on yours, and your car is worth $20,000, guess what happened? Your car their insurance company is going to pay for half of your car.
What else?
So you have to properly insure yourself
Exactly.
and ignore those commercials that say, "Oh, we will save you X amount of money." You know why? Because they're stripping it down. It's like going from you drive a very nice car. There's a standard model, and then there's the model with the cooling seats and the other things. We are the cooling seats. I like to say, we're the Verizon of insurance. Not the cheapest, but the best.
And you have some bells and whistles, and you can choose those if you so choose. But because there's obviously levels that you can get yourself insured at, but you want to make sure that you're covered significantly.
Exactly. Knowing what your payout is for different situations is so important. There's more cars on the road. People have more accidents. More houses are getting broken into. So many different things are happening in the world that are just you're creeping up on us. You just assume like it's never going to be me until it is.
Right.
And then you need to make sure you're covered because liability is, I'm telling you, slip and falls in your house. So many things can put you, in court with somebody suing you.
Yeah. Or you can lose everything.
You can lose everything. You can have liens against your property, against your business. It's very important.
And so that's why it's important to have umbrella. Do you do umbrella?
I do umbrella. I cover umbrella policies also, and that's really about assets. If you've got multiple assets, you definitely want to have umbrella coverage because boats, things of that nature, you have a lot of liability when you have all that stuff, and it gives you some higher payouts. As far as the coverage it'll provide you, if you have the umbrella, it adds to what you already have, and it's actually a good thing. It's a very good thing. Most people just don't want to pay the price until. My insurance didn't sell me the right insurance policy. No, you wanted the cheapest insurance policy possible, and kind of.
And when you have the umbrella, then doesn't that set a set of limits that you need to cover also? Meaning, like if you can't just get the cheapest car insurance and have an umbrella. You should.
Exactly.
It has a standard that you need to have on the basic coverage, and then the umbrella.
Exactly, and we go through all that, and when we are selling it to you, no matter what I've done in life, I managed education for the state of Oregon for Sprint for 4 years. And I always sell benefit because benefit is what's going to, when push comes to shove, you're looking for the benefit of having anything. What's the benefit of having a Bluetooth, not getting a ticket? What's the benefit of having a car that with extended warranty? I'm not coming out of pocket, it's going to go sideways. Sell benefit. What is the best thing for the customer?
But the thing of it is that a lot of insurance agency does not tell people what type of, they don't basically explain to the fullest what type of insurance that they have. And so a lot of times, a lot of people are driving around here with not enough insurance, or sometimes they have too much, something that they don't need. So what can you say, what sets you, why would you stand out among the rest?
Because my first goal is to educate anybody I sell to.
Right.
You can say, give me the bare minimum, and I will tell you why the bare minimum may not work for you. I would rather you come back. My big thing when I owned my own store, whatever it was, but I owned a couple of Nextel stores, is I don't want to see you unless you're happy.
All right. All right.
Or you're here to buy something. So we're going to do it right the first time. Simple as that.
And that's probably a good place to pause now, because we're going to take a break, and I'd like to come back in and speak about that, finish up on the insurance piece before we actually dive into the main reason why we are here today.
Okay.
But since we have a few seconds, let's go ahead.
Shaking the table again.
Yes, you
Let's
keep
go
on
ahead and,
shaking the table.
So you're listening to the Many Shades of Pink and Black Health Radio program on kblkradio.com, and we'll be right back.
I'm a breast cancer survivor.
We are honoring our heroes.
I'm here today because of Susan G. Coleman's free mammogram.
We are pledging to save lives.
We're passionate about bringing the services out to the community.
We are providing free mammograms. We are providing hope.
We are more than pink.
Made possible by Anderson Plumbing, Heating and Air.
Welcome back to the Many Shades of Pink and Black Health radio program on kblkradio.com, sponsored by Many Shades of Pink. I'm your host, Wendy Sherrill, breast cancer survivor and advocate.
And I'm your co-host, Dr. Susanna Fallo, and we have the pleasure of a special guest today, Mr. Terry Robinson. He's an insurance agent. We're going to start talking in a few minutes about the actual event that we're having this Saturday, and that's Hornets and Friends' second annual cancer and diabetes event. But before we jump into that, I really want to kind of tie up the loose ends on the insurance information.
Yeah.
So Wendy, before the break, had asked you a little bit about insurance and having enough coverage or not enough coverage. And I do know you can have a good level of coverage, but you also get to gauge how much money comes out of your pocket by choosing a deductible.
Correct.
So
that's
that
called
that
shared
can-
responsibility.
Right. So that you can either cut down the cost, either when you pay out for the incident, or cut down the cost on your monthly, or your premiums.
Yeah, the higher deductible is really meant to, it's called shared responsibility. So you're taking responsibility for more of what is actually going to be paid out in an accident. And, some of the insurance companies go with the higher limits, 1,000, 3,000, 300,000 and 1,000. But you really got to look at that and see, okay, if I'm driving a 1992 Honda Civic, how much damage can that car do? So if I'm insured for $100,000 on a Civic, I'm overinsured. Overinsurance is a real thing.
As I said.
What happens is, it's like going to a car dealership. This is my favorite analogy. You go in there focused on payment. Guess what? They're going to get you 7 years at whatever payment you walked in there expecting.
Or if you choose you want the lowest payment, right? They're going to stretch it out over those years. So,
Exactly.
You
have to go in with a reasonable expectation of what you want, and then understand what could happen. I think the most important thing is people don't think about, let's say you never had an accident. Well, you're not really going to think about what could happen.
Right.
So you have to have an agent that will talk to you about, what do you do for a living? Where do you drive your car to? Do you have kids in the car? How old are they? There's a lot of conversation, a lot of things that happen in the course of driving that are distractions. And in understanding, do you on the weekends, do you go out to the mud flats? Okay, that's an Oregon thing.
I was gonna say,
what is that?
What do you do in your your leisure time or your recreational time? There's just a lot of different little things that you need to have a conversation about. And some people just want to get what they need to have insurance, and that's not always the best thing for you. So you need to find an agent and be able to ask questions. And if you don't understand them, Google it.
Right, because some people don't know what to ask for.
Exactly.
And the wrong agent might walk them down a path that they may or may not need.
You could ask on Google, what's your average payout for a property damage payout in this zip code, and it'll tell you.
Okay.
So it gives you a better idea. But you want to look at the type of vehicle. If you're driving a Ford F-350, well, if you hit somebody, you're doing damage. So you have to kind of calculate, if that vehicle got into an accident, what would that look like? And you need to have an agent that's going to, if you call your agent and just say, I need a rate, and you don't have time to talk to them, there's a responsibility on both sides. You call your agent, have time to talk to them. And get a personal agent. You can do the 800 number or whatever, but get an agent who actually has the time, somebody you can trust. Trust is obviously, when you spend your money, is a big thing.
Right.
And make sure that you have an understanding of what. Take some time, block some time. It's your life. Figure out what's important to you.
Right. And I was just, the reason why I asked about the umbrella policies, because I just remember when I was raising my nephew and he was bringing his friends over, I'm like, do not bring anyone in the house when I'm not there. Because if they trip and bust their head open, we're going to be out on the street because their parents are going to sue for the house. And I had to get an umbrella policy just to make sure I could protect my assets from this teenager, right?
Yeah, you gotta look
Right.
at how often people are over, how many
Right.
people are over. Do you have a basketball court? Do you have workout equipment in your gym? Are you letting other people use it?
You have a
There's
pool.
so many. You have a
It's
pool.
a lot
yeah,
of
pool's a
stuff.
whole-
It's so much stuff that you can find yourself caught, off guard.
Yeah.
Mhm.
So
You assume that it's covered,
exactly.
but to what degree is it
Right.
covered? And then that's where the lawsuits come in. People become, not evil. People become enemies over things like
Yeah.
this because, something happens and they might feel sorry, but there's an expectation that if you're reliable for it, you're going to pay for it.
Right.
And when you don't have the proper insurance, that's what happens.
The other thing about it is you have to think about the amount of insurance for your home because, God forbid, if something happens to it, like burns down, then what you get back is not enough to even rebuild what you had. So you have to make sure that you assess what's in there and how much. It's not just the property, the land, and what but what's the structure and everything. Because
All of that.
and the current rate, right? Because things go up, steel goes up, wood and all that, and so now whatever you got back then, if you don't update it or upgrade it,
Exactly.
then you will have a house that was 4 bedrooms. Now you got 2 bedrooms because that's all you could build with the money that you're getting out of your
But the
payment, right?
thing of it is that also you have to look at the same thing with cars.
Right.
True.
Same thing. They may pay your car off, and then you're out of luck. You don't have no money to go and buy you another one or a down payment on another one.
So when we insure your house at Farmers, we do it by replacement cost. What is it going to take? Our system calculates what is it going to take cost to replace your house in our current
Market.
market, right? Okay. And then another thing to consider is what you own.
Right.
It's basically, this is our little, take your house, turn it upside down, dump everything out of it, and what would it cost you to replace it? Not what your raggedy TV is worth.
But what is going? Yeah.
What is it going to cost to replace it brand new?
New, right.
Because they're not going to sell you used things when they replace
Right.
your things.
Exactly.
So we'll have people call in and want renter's insurance. Oh, I don't have $25,000 worth of stuff. It's like, no, but if you had to go out to today to IKEA or whoever and replace everything,
Everything
your
you
house
have,
burned down, and you had to replace everything you own, what does that look like? It doesn't matter that you got it at a garage sale. It's a table you have to replace. And and our expectation is you replace it brand new with so that's the part that people miss. And the renter's insurance, so many different things go into the renter's insurance.
Yeah.
You're insuring yourself against what could happen if you burn down the building.
Right. Or any
Or the upstairs flood your apartment. Or
everything
something.
because see right now when you rent a place, owners it's required for you to have renter's insurance.
Yeah.
Okay, we require you to have renter's insurance because this is what we're saying. Now, I had all kinds of things happening with the tenants. Like something happened. Oh well, you guys are responsible. No, read your policy, read your lease. You're supposed to have renter's insurance. We're only going to take care of what's required, but the insurance is only going to pay for it if you do have renter's insurance.
It will take care of it. You'll have insurance on the property,
Right.
But let's say I burn my duplex down. You gotta go somewhere.
Yeah.
Right.
Renter's insurance takes care of that.
Right.
They pay to put you up in a hotel, feed you,
Mm-hmm.
and you're supposed to live reasonably, not like Motel 6. They put you up to live reasonably until that's fixed, or you find
Exactly.
another place. So there's more to renter's insurance for $9 to $15 a month than
Exactly.
people ever think about. They just think about replacing their things, but what if you could not go back to your things for a while? You need someplace to stay. You want to stay with your mom and daddy, uncle, cousin? Something to think about.
And and the thing of it is that they are also that if they want certain things covered by the owner's insurance, the first thing that they want to know, well, does the tenant have renter's insurance?
Because they don't want to pay out everything.
Exactly.
Right.
It's a slippery slope
It
because
really is.
people do a lot of different things these days that don't make a lot of sense. We have more latchkey kids at home that burn down stuff. My son, when he was 5, he was playing with something and got scared and threw the match into the laundry hamper.
Oh my God! But wait a minute, that's not nothing. I did the
There's a
same.
toilet right there, man, with water.
Yeah.
There's a laundry hamper with clothes
You
in
just
it.
get scared though.
I know, but I'm saying, I know, but it's like
I did it.
they were next to each other.
I know. I did it
Go
when
for the
I
water,
was,
man.
when I was probably about 4 or 5 years old, I, seen some matches. My mom was asleep, my brother was asleep, and I just kept on,
Curiosity.
just curiosity, just kept on. Couldn't do it. Then I finally did it. It was like, ah! And it's just threw it. I threw it on the couch and it burnt the couch.
Ooh, that did not work out well for you. I'm just gonna assume that didn't work out so well for you.
Her butt was sore for a month.
Yeah, exactly. But insurance is a very necessary thing in your life. Some
Yes.
people call it necessary evil. I call it necessary because our stuff, we all work for our stuff, right? I mean, it's worth something to us at some point. Why not take care of it? I keep things forever. Because they go in a place. There's wintertime it comes out. There's summertime it comes out. It goes in a place. It's packaged. It's put away. Most of the people that are with me during this event know that I'm a very organized. We'll just call me organized. I've been called a couple of
Well,
Yeah.
Sis is a very, very, very organized person too. Very, everything's
Meticulous
on.
about
Yeah,
stuff.
very meticulous, and
That's the
everything
word I was looking for.
have to be on point. I'm organized to the T. Now, if you come to my house is very organized. I mean, it's gonna be like spotless, and I didn't know that. Everybody thought that I was just like such a neat freak. But when it comes to other things like, paperwork and all that stuff,
That's
I
not
like
priority.
That's limited in your scope of what's important.
Yeah, exactly.
All right, good enough.
So we should probably, for the remainder of the time, we should really dive into the actual event.
That's
Yes.
right. Let's
We got like
jump
a
in
good
here.
25 minutes.
All
So
right.
Yes.
let's tell folks about this. You have the platform to speak about your program.
Okay,
Okay,
but
so-
let me just ask you one question before you get started.
Am I gonna fix your logo? Yes, I am.
No, okay. How did the Hornets and Friends Cancer and Diabetes event come about? How did you guys come up with that?
I'm glad we got 26 minutes. All right,
Okay.
so here's what happened. What had happened was, no, seriously, that's not where the whole concept started. It started with, let's do something with our alumni brothers and sisters that was free. That was the original thought. We were at a birthday party for Michael and Michelle Allen. They were doing their 50th birthday party up in San Juan Capistrano. Beautiful party. Coincidentally, and I think God was in this because...
Was that 2 years ago? Because I remember.
It was 3 years.
Oh, 3 years ago?
Yeah, 3 years. It'd be 3 years ago. Yeah. And so I just happened to come to the lobby of the hotel that we stayed in that night, and some of the other alumni folks were there. And we started having this conversation that things have gone right, things have gone wrong within the Lincoln structure and alumni. And we just said, we need to do something where we can just have everybody show up,
Right.
And my co-chair, Carolyn Wiley, has been with me. She was sitting there with her husband, and we said, let's do something. Well, right after that, folks started dying. I mean, in succession, monthly, we had people dying of complications from diabetes. My mother died that following April from complications from diabetes. We had one of our brother named Daryl Wallace who lived right down the street from Lincoln, where his house was where the stadium is growing up. He passed away.
And what did he pass away from?
I think it was something to do. I don't know if it was heart failure or something along those lines. I can't remember exactly what it was. And then there was just a succession of people and we're like, whoa, time out. Something's not right
not
here.
right.
Why is it this? You draw a map, you circle, and all these people are, and my first thought, it was like, wait a minute, we grew up in all these schools that were built in the 40s and 50s. So at that point, I think we dealt with a lot of lead paint, a lot of asbestos, a lot of things that, if you probably go back and look at the EPA report for when they tore down Lincoln, I'm pretty sure it's not pretty, okay? But, so it transitioned in from let's have a party, which is always our first thought, to, we need to bring some awareness to this. Why is this all of a sudden the devil just popped up and decided to run the party? And we're like, no, we're not cool with that. So our first event we put together, all alumni donations, some from the community, and we had it at Roar Park. We didn't have a relationship with the principal at Lincoln High School at the time, so we did an event at Roar Park, had about 100 folks show up. We had food, we had healthy soul food cooking, we had doctors there doing glucose checks and blood pressure checks, and we had maybe 2-3 doctors there, We had food for the kids. You know, I always like to feed the kids because I'll tell you why in a minute. But and we had games for the kids, and it was great. It went over great. And then we, you know, kind of took a break from it, and we did another event for the alumni, which was actually a barbecue. And then we wanted to integrate with the actual school itself and make sure that we were part of the bigger healing process of, you know, which is another whole other story, but with alumni working with the school. Because a lot of people go up there with good intentions, but they don't work with the school closely enough to understand, you know, you might want to give the school something, but is that what the school needs? And how you go about that in the right way so that there's no conflict on you trying to do a good deed.
Okay.
So we had that event, and then this year we pretty much just said we created the relationship with Malik Bacon, who is the ASB advisor. And for those who forgot what ASB is Associated Student Body. I keep looking up there like the camera's up there, like it's right there. And then we created a relationship with Mr. Soto, the principal. And, you know, there's one thing you can always be guaranteed by. Guaranteed. If you mention cancer or diabetes to literally any single individual walking this planet, they're touched by it. Directly or indirectly. Somehow, I mean, you've been touched by it. We got speakers I didn't know until our pastor, who's going to speak for a second, Eggershart, he's a cancer survivor.
Right.
People don't talk about their illness a lot of the time.
Well, that's the problem with our community. You know, no one wants to speak about it, but you know, if you don't speak about it, how do you, you know, how is your family going to know their history? There's so many people that don't know their family history, and if they would know their family history, they would get, you know, something, you know, like far as screening of whatever that family member, whatever that cancer that family member died of, they'd start getting a screening much earlier, sooner. So that's something that, you know, we always talk about, how in the Black household we need to have communication about health. It's not taboo. It's basically ensuring that your future generation is prepared for what you guys have already endured.
And a part of that was I had a grandmother. My family history speaks for itself. My grandmother on my dad's side, she lost both of her legs from the knees down for diabetes over time. I didn't know anything about diabetes. And then my mom died from, my mother got gestational, how do you pronounce it? Gestational diabetes. When she had during pregnancy. And then one of the things I've noticed about us diabetic also, runs in the family obviously, is that there's a maintaining and there's a getting better mentality. Some people, I think my mother's downside was, my mother would love to eat. And if you've ever been on my Facebook page, you know there's some food on there.
Oh,
so
I have seen your food on there.
Yeah, okay.
I'm like, okay, look at him, always posting food.
I have the same problem. I try to cook healthier.
Yeah.
I read a lot. I've been reading a lot lately on, you know, combinations of food, how they work together, et cetera, for your body, et cetera. And one of the things I think the senior population does is they maintain with all of the drugs, with metformin and all these things, but they don't do enough to actually get out of it. And at a certain point, I believe, you can speak to this, your body is what it is. My mother was at Scripps, and essentially in the newer section of Scripps, her organs started to fail one by one. She had triple bypass surgery, and most folks that know me don't know this story, but her organs started to fail one by one. And she was hooked up to 4 or 5 machines. They needed to move her in the hospital, but every time they unplugged the machine, an organ stopped working. There was a certain point they're like, we don't know what to unplug, not to kill her on the way to the to where we need to get her to. So, and I felt bad for the doctor because he's like, but my mother knew, and a lot of us know. It's just you can have the knowledge and still not do the right thing.
Correct.
There is just a part of that, but you have to have people around you that support that.
Right.
You know, you can't. It's about you, but you need to surround yourself with people who actually care and maybe are living a healthier lifestyle that maybe you might be living, or just connect with those people. They don't have to live in your household, but connect with people, the workout partners, things of that nature, the people who will call you out you know, when you
That's
post a big
right.
plate of pork ribs, or
No, you're not supposed to be
you know,
eating that,
it's
okay?
like, wait a minute, don't you have high blood pressure? Send that to my house. So that, in combination with just a lot of different things I've seen in this community, mind you, once again, I live in Portland, Oregon. I don't live here anymore. At this point, I've lived half my life in both places.
Okay.
But I'm here. Some people think I still live here. I inherited my mother's 619 number, which I'm very proud of, and it's actually helpful in what we've been doing, because if I call from a 503, they think I was a bill collector.
Right, it wouldn't pick
So
up.
they wouldn't pick up. So with that being said, I think everything that happens for a reason. Our parents are example, good, bad, and indifferent. And sometimes I come from parents. I was sharing with Dr. Follow. Most people around here that grew up my age know my father. Robbie Robinson was football coach, baseball coach, vice president of Valencia Park Pop Warner. When he passed away at 61, he was the rules. He was in charge of rules for all of San Diego County Pop Warner. Okay. So he was always involved. He was always taking kids home. So anybody out there, you know, my pops is. You know, he was always driving people home from work. He worked at National Steel for almost 40 years. So very solid examples of giving back to the community selfishly, unselfishly, driving kids home. You know, we would get in the van to drive home at night after football practice, and wouldn't get home for an hour.
Dropping everyone off.
Because we were dropping these kids off in East San Diego and everywhere else. So people keep asking me, how do you do all this? Why do you do all this? That's what I know.
Yeah.
You are what you eat.
Right.
You know.
So what should the community expect at this event, and what are your goals for the end result for the future?
Diversity in this event. Now, here's the thing that people get caught up on. It's called the Cancer and Diabetes Awareness Event. But we have mental health professionals there. We have an infectious disease doctor, Dr. Ronald Shockley from Las Vegas. He actually, in the 80s, he went to a program where Lincoln had a medical program. He didn't graduate from Lincoln, but he attended Lincoln for a while and was part of that medical program. Okay. Well, he's an infectious disease doctor now. We have Dr. Rennell from the Medical Health America of San Diego is going to be a speaker. She's a Lincoln High School alumnus. We have a number of different, we have estate planning.
Okay.
From the insurance perspective, we have estate planning. We have Greenwood. At some point, you're going to go, whether it's natural or whether it's from
Greenwood Cemetery.
You have someplace you have to go, and those folks are there to help you before and after. One of the things I learned when my mother passed away is when people don't have their things specifically in order, woo-wee, kids get left with some work to do.
Yes.
And you know, siblings don't always get along, and sometimes things just don't go the way you plan.
Oh, I know
in your
that.
head,
I know that
you know,
firsthand.
they want you to be in charge, but they don't want you making decisions.
They want you to do all the work.
I don't think any of my siblings are gonna be watching this, so I'm gonna forward it to them anyway.
They want you to do all the work while they reap the benefits.
Exactly. So I'm gonna leave that at that. But so we've got kids games. We've got kids games where trophies. The trophies. We have football toss. We have golf.
Oh, that is awesome golf.
I'm very proud of the golf part, because we rented a putting course for the kids to come out. It's about 8 feet, and the kids get 3 shots. It'll be open starting at the beginning of the event, so kids can go over and practice.
Okay.
I think it's safe to assume that our community is not heavy in the golf world. A Tiger went away, and so we think we lost our interest to a huge degree. And so there'll be a golf instructor over there. There'll actually be a young man named Justin Woods. Shout out to Jacqueline Owens, his grandmother, who inspired me to move this to a golf opportunity.
Well, I'm glad you did.
Yeah.
I really think that our youth have something in them as far as golf, if they indulge in it.
If you don't have access, then you don't care.
Right.
If you do, you know, that might be your thing. You just no one ever gave you an opportunity to experience it. So then we also have a game, as we called, everybody that's ever played basketball knows horse.
Horse, yeah, horse.
You know, if you make a shot, you make a point. You miss the shot, you don't get a point.
Exactly.
And then we have a tie, we're going to do speed horse. As many shots as you can make. You can go right to the 3-point line and just shoot away for 60 seconds.
Right.
And we designed these games so that they were interactive with 7 to 10, 11 to 14. But as we know, the kids bring the parents. And they're an important aspect, because if they don't hear what right looks like, they can't even say anything to their parents. Hey, I would rather have this versus that. And you'd be surprised, some kids will, because they're little sponges and they're trying to learn. And if they are educated properly, they'll understand. I should be eating oranges. I don't need Cheetos.
Right.
But if you go into the dollar store, what you gonna find?
Cheetos.
Cheetos. So, well, the dollar store is here. You can actually buy fruit
no,
too.
I have to say, not go to the 99-cent store. They got fresh veggies and fruit and everything else.
But the kids will buy what you give them and what they like. And sometimes they don't know they like something till they try it. I'd rather now eat an orange than a bag of potato chips. I'm 54 and I know better, but I actually prefer oranges now. But my dad was about trying every single thing. Brussels sprouts, liver, lima beans.
Don't say liver. Ew.
Oh, no, lima beans?
No, liver. That was
Swallow a Brussels sprout whole in my family. You'd be like, good luck. So the event is just has so many aspects. We've got a gentleman named Nasira that's going to come out, and he's going to. I'm going to stay on the Hornet Games for a minute. It's kind of the most rah-rah part of the event for the kids, and I want to emphasize the kids for a minute, is that there'll be cheerleaders there from the San Diego Kings basketball team, and the kids are going to do a big warm-up, like it's like a marathon warm-up. Nasira does that type of thing, and then they're going to run into the gym through the cheerleaders.
Okay.
They get trophies and medals. We also have some really cool participation medals for the kids who don't win a trophy, which are being shipped right now because I left them at home. That's another conversation we'll get into after this event. But they'll be here tomorrow. And then we've got folks like the San Ysidro Clinic that are bringing their HIV van. We have also a vegan cooking class that will take place. Lincoln High School happens to have a healthy cooking class. Okay. I'm not sure if they call it healthy cooking class, but they have a cooking class. I think it's a vegan cooking class. We also have the San Ysidro Clinic HIV van that's going to be there. I know it's a touchy subject for people, but you need to know. Okay?
We have it at our event every single month, so it's it's in this day and time. No, it's not uncomfortable. It needs to, it needs to be addressed.
Conversation. I think it's the same thing with mental health.
Exactly.
It's one of those things that we don't talk about. You got your crazy uncle. Well, your crazy uncle might just need some medication.
Yeah.
He ain't crazy. It's just sometimes things in your body change and you have to deal with it. We also, one of the things that Dr. and Follow I worked on this weekend and just hit a home run is we have flu shots.
Yeah.
There's some scragglers out there that have not gotten a flu shot. So we hit this. I put an email out on a Friday, and by Saturday afternoon, we literally got the last 100 flu shots in the county almost. I mean, there aren't any out there. Right. The county was like, we don't have any more, and blah, 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 and Champions of Health.
We gave you guys our flu shots from our event. No, I'm joking.
We'll talk about that later. So Champions of Health, which is another group that does a lot of sponsorship, they're bringing flu shots. So if you have not gotten your flu shot, Saturday's a good opportunity to come in and get it done. We have just added the Black Nurses Association. They will be there. We have a really cool photo booth, which is a 10 by 10. You can come in, and when you take your picture, it'll have a Lincoln logo. You
got that next to me. Oh, how fun that gonna be.
You're gonna get a lot of attention though. Everybody come in your direction. We have some great speakers. We're actually, I don't know if you've ever been into the Lincoln High School Theater. It is a first class theater. They spend a lot of money, and if you've never been to that theater, you should take a moment and go in there. We're going to have 4 different speakers. One is going to be on, we're going to have the Family Health Center right next to us. They'll be there, and they'll have some talking points on prostate cancer, etc. At 11:15. So I have my little list here.
Yes.
And then we have our breakout, we call them breakout sessions. They're educational breakout sessions. Then after that, we have Greenwood. We'll come in and talk about what does it look like. Most people don't want to talk about that, but what does it look like? I didn't know the cost of cremation. That's what my mother wanted, and we didn't know. And then you got to buy the urn. And they won't go in probably that great detail, but you can start that conversation because we all go at some point.
Right.
It's just at some point we're all going to go. Then we also have a breakout session with,
just name them on down. Just give the times and the names.
No problem. At 12, let's see here. So the 12 o'clock is going to be the breakout with Greenwood. At 12:45, these are all 30-minute sessions, will be the breakout with Mental Health America, which is Dr. Rennell, who is a graduate of Lincoln High School.
Is that Rennell?
Latanya?
Latanya. Oh, yeah, that's my cousin.
It's a small world. Okay. And then we're going to have at 1:30 we're going to have the WFG, which is the World Financial Group, and they help you with estate planning.
Okay.
And I think one of the things going back to insurance is, do you have a life policy? Do you know that that creates instant cash if you have a life policy? Most people don't know that. You can borrow from it at some point in your lifetime when it builds up. So that's a savings that most people don't even think about, but it'll also take care of your estate when you pass. So that's really something that, you know, and we as a people need to do better at, is making sure we have a life, not just that little one you have at work, but a life policy that's based on the assets that you are responsible for. Going back to the whole insurance conversation.
Right.
What assets are you responsible for, and who are you leaving around? I mean, you leaving that for your kids to deal with?
Right.
You know?
Right.
So they'll have that, but during the course of the day, we're going to have these fitness demonstrations in what we call the circle. So if you've ever been to Lincoln, there's a green area right in the middle, at the middle of the center quad, and all the booths will be around it in a square. And there'll be someone there, Nasira will be there doing just fitness demos. And then one of my favorite, and that starts at 11:15. One of my favorite speakers, if you guys have never met him, you actually met him recently. His name is Sigmund Valentine.
Oh, yes.
He is one of the funniest brothers that you will meet. He's a comedian part-time, but he also sells a product called Superfood. And he is going to speak about it in the circle outside.
Okay.
He is a great speaker, and he's just funny.
Yeah.
He just keeps it real
Use that
about,
as comedian,
you know,
just local shows or something.
yeah, exactly. Then what else we're going to have here? Fitness demos. Those two will be going back and forth in the circle. One of the highlights of the event involved these two young ladies, which is the Circle of Hope. The Circle of Hope is an opportunity for us to talk about what we're dealing with. The very special part of this thing from the beginning is we have a 10-year-old, Justin Woods, who is going to do, to help us celebrate with Black History Month, he's going to do a 5-minute version of I Have a Dream.
Okay.
He has done it in a number of different places. He lives right here off of Logan, and he's done it he did it on the Midway for MLK Day.
All
Very
right.
good at it. We're going to have Assemblywoman Shirley Weber. So we're going to, I thought it would be really cool to have him from that perspective, the speakers, him, and then lead into,
Oh yeah, that's awesome.
because
Yeah.
it's a black woman as assembly. I mean, this is the dream. This is the dream being accomplished.
Right.
So I thought that was a good lead in. We also want to, you know, a big part of this, which I haven't talked about, is the students at Lincoln.
Right.
We wanted to do something with the students at Lincoln. So we're going to have the ASB
Okay.
president speak. And then we're going to have Miss Wendy, I believe you come in. I don't have that list right in front of me. Yes, I do. You come on right after that,
Right.
and you're going to start the conversation about cancer.
Cancer. Right.
We have two young ladies, one that is in remission, one that's going through it right now, Lillian Moss.
Right.
She's a retired Navy. She's going through it. She shaved her head. She's beautiful with a bald head. She's one of the prettiest people I've ever seen with a bald head.
She's rocking her ball head.
Oh, she is killing the ball.
Okay.
Seriously, she's killing the smooth head.
Yeah.
And she's going to tell her story. She's currently going through triple negative.
Yes,
breast
triple
cancer.
negative, breast
And
cancer.
I don't know, can you explain, everybody keeps asking me, what does triple negative mean?
We're gonna have to explain it another day because we just don't have enough time.
Oh, okay, that's a long one. That's a long one, okay. So she'll speak about being in it, and then Deborah Thomas, one of the alumni at Lincoln, will talk about being in remission. And I think people go into remission thinking that everything is super easy. And Deborah's kind of coming to tell you, it's still, there's a battle to be fought.
Well,
during
yeah,
remission.
Deborah is our volunteer for Circle of Promise, and so we, you know, she's been around us for quite some time. But it's not to cut you off.
No
but-
problem. I see the time.
But I need to mention one thing.
Yes.
Because February is Black History Month, so we're going to address that. But it's also Heart Health Month. And so I'm
right.
going to speak on heart health because I
Exactly.
don't want people to miss that opportunity because diabetes and hypertension are two risk factors for heart disease. And so
Exactly.
we're dying, especially women of color are dying from heart disease. So
Yes.
to me, that's the key thing there too. I mean,
Exactly.
all of that's important: cancer, diabetes, hypertension. but the heart is the one.
The
that's
heart
gonna-
is too,
that's gonna
yeah.
Yeah, if
be
it stops
involved.
it and everything,
That's
it's
it.
a wrap.
Right.
Exactly.
So we'll use that opportunity to focus on that. But let's go ahead and mention our announcements real quick.
Yeah, so
Okay.
we've already mentioned
Yes.
the Lincoln
Yes.
alumni. We already did that. So we want the community to come on out and support this, event February the 10th from 11 to 3. So if you're in this area or if you're not in this area, just come on out and, support this event. Sis, you want to do that?
Yeah, and then of course our monthly community outreach event is on the third Wednesday of each month. So our next one is going to be February 21st, Wednesday, between 10 and 6. It's at the Big Lots on Federal and Euclid, and that's 1655 Euclid Avenue. We have a host of vendors there that are going to provide various services similar to what we're going to have this Saturday, but we do it on a regular basis, not on a monthly basis, but not on an annual basis, but monthly. So we'll have all kinds of services available to you. Please come out. There still will be free mammograms, blood pressure, diabetes screening, all of the testing, HIV, hepatitis C, vaccines, and things like that. We're also giving out food distribution. So please share that with your family and friends and neighbors who need services. This is really geared to the entire community, but definitely the people in need. And that's, so remember, February 21st, that's on the Wednesday.
Okay, and our next event is the Coleman San Diego Circle of Promise Fashion Show and Breast Health Luncheon. That's February 24th from 10:30 to 2 p.m. at AMN Healthcare, 12400 High Bluff Drive, San Diego, California, 92130. The fashions from the stylist, Candy Macon, and the owner of Cotton Candy, and Tanya Jenkins is the designer, and she is the owner of I'm messing this up. So Tanya, if you hear me out there, I'd have messed up your company name. And the MC is Stevie Flowers. She's just awesome. She's a survivor. She survived stage 4 breast cancer. And we're going to have so much more. We're going to have the music sensations, the harpist, Maria Antoinette and Ken Turner, and myself and my sis here, Dr. Susanna Fallow, she'll be doing the what is that?
The educational piece.
The educational piece, but what we call it is the perfect storm.
Yeah.
The perfect storm, and that's the latest on the African American and breast cancer. So come on out. This is a this is a free event, and we want you guys to come on out, get educated, and also see the survivors. We are the ones that's going to be rocking the fashion. So again, did I mention that it was free?
And on top of that, all three of the events we've spoken about today. So the event at Lincoln, the
Yes.
health fair with the diabetes, cancer, and blood pressure, heart disease focus, that, and especially for the children, that's a free event.
Yes.
Yeah, it includes free lunch for the kids between the 12 and 1.
And
Yeah.
then also our monthly event is a free event, and then the fashion show is free.
Free.
We're trying to do everything and provide things for the
The
community.
community,
So,
yeah.
all right.
Yes.
With that, we need to thank you for coming
Yes,
on the show
thank
today.
you.
Now that
Thank
we've run
you.
out of time.
Can I say one last thing?
Yes.
We have a great raffle all day long. So come and get free prizes all day.
All righty.
All day.
So you've been listening to the Many Shades of Pink and Black Health Radio program on KBOKradio.com, sponsored by Many Shades of Pink.
Yes, and we'll have a great weekend.